It is very important to understand that boys and girls have different symptoms. Girls will have a totally different outlay about the symptoms of autism. They will have a very narrow vision about their interests. They will have a very narrow sight of seeing on the interest they have in things. For example, in schools, they will have total interest in one topic, one thing they will be doing and continuously talking about. Similarly, they will have to rely on others' communications, means they will be relying on the communication patterns and words of their fellow peers or their teachers or whoever is taking care of them. They will not be able to understand things on their own. They will be relying on some other people. Similarly, there are other things they will be doing that are different from boys that are having autism of the same age. For example, they will be having interest in one topic from a movie, from a TV serial, or any program they like. They will not have the comprehension of the whole program. They will keep talking about one scene, one portrait, one location in the movie or a serial, a TV serial. They will only talk about one thing. They will be focused on one thing, but still they don't have understanding of the whole feature whatever they have seen. They will keep talking about the same thing again and again, and that is the reason they will have difficulty in making friends inside the school period. What happens, because other people will start thinking that why they're talking about the same point again and again without making any sense to the rest of the scenes or the whole film or any particular movie they have seen. So this will stop them from making any social acquaintances. So they will be finding it very difficult, especially in girls, they will be finding it difficult to make friends because they are having a single point of focus. Just like boys, they have single point of focus in activities, but girls, they will be having mostly single point of focus in terms of attention, in terms of certain location, point of discussion, only one point. Autistic girls, they will have a very sensitive response to sensory changes. For example, they will be very sensitive to light changes. If you have a dark light, like a dull light, whatever the change you have, it will impact them straight away and they will respond very quickly. Then to loud noises, they will respond very badly. It can be response because it will irritate them. Then bright lights, sensitive sounds, or anything that is a sudden change on their sensory feelings, it will impact them badly. So they will be susceptible to sudden changes into their sensory neurons. So these girls will have different symptoms as well in terms of their mood swings. They will have sudden tantrums thrown up. Sudden mood swing is there, so they will behave very sudden. It can be aggressive or in any other form. That is the reason they will have more and more depressive feeling, and they will have more, for example, they will start getting more suspensions and detentions inside the school time. It is not that they want to behave like that, it is instinct for them because their certain behavioral pattern has not been developed because of autism. This is one of the symptoms. If they start getting more and more of these kind of behavioral pattern, we should be consulting with the specialist. So when we talk about autism in females, means especially young girls, you will be finding a certain disorder behavior of eating as well. For children, it is very uncommon to see this behavior for us to see in children because we can say that the children are like that. They can eat in a disorderly manner. But as carer, as parents, as caregivers, you have to understand these factors. You have to take into account these factors. These are the main symptoms of autism in girls. And another thing you will see that in these young girls that they will have a depressed mood, they will have anxious feelings, they will have other mental health symptoms in their behaviors. In their behaviors, I'm not talking medical disease symptoms. These are behavioral systems and behavioral indications that you have to look for that will be shown in their behavior. They will be anxious most of the time. They will start behaving in a sudden quick shift of mood. You have to take into account into a child whenever there is an abnormal behavior that is not concurrent to the children of the same age. These are all symptoms that you have to take into account when you are taking care of some children, either in the form of your parents, caregivers, teacher. We should all be responsible for learning these features because we are taking care of them children. So we should be learning these, and then only we can take care and rectify them to the right authority. Hopefully you have learned something positive. Thank you very much.